I just want to sort of clarify, are there any specific symptoms or signs that women should be aware of during menopause that could be indicative of heart problems or issues? And I'll tell you, I heard from several women on Instagram in my DMs who asked specifically about their heart palpitations, and they
Mhm.
wondered if those are ever an indicator of heart disease.
So the answer is yes and no and no. So let's
Okay.
unwrap this.
Okay, good.
Palpitations in women, often misunderstood, especially if you are perimenopausal. Now, what does perimenopausal mean? You have not entered menopause, but you are in the early phases. Generally starts around the age of 41, certainly can vary all the way up until 50, but that's perimenopause. Still having menstrual cycles. You have not had your last menstrual cycle, but your estrogen levels are beginning to fluctuate. Women during that time can develop palpitations. So these are confusing symptoms. So palpitations are rapid heartbeat or rapid flutter that can leave you breathless. You feel it in your chest. Now, those can send you either to the emergency room or to your physician to check these things out. And of course, you likely have gone through a cardiac workup, which actually is appropriate, right? So if you have palpitations, let's have a cardiac workup. Let's get an EKG. Maybe we need to have an event monitor on you, and then other tests directed based on those kinds of things. But in the end, if nothing is found, we have to begin to consider that palpitations are also a symptom of fluctuating levels of estrogen and perimenopause, and whether it's time to begin to consider menopausal hormone therapy as well. Now, that's not something that is generally ascribed. If you go to a
Mhm.
cardiologist, and I am a cardiologist, and you've been referred for palpitations, we're going to work you up for palpitations and look for a cardiac reason for that, either yes or no. If we find something, then we'll do something about it. If we
Mhm.
find nothing, you're sent back out into the community. And we need to begin to understand that palpitations are not equal in all sexes and in all age groups. So, yes, palpitations can be a sign of heart disease. They also can be a sign of menopause and that it may be time to consider hormone replacement therapy.
Thank you, Dr. Morgan. And I really appreciate your saying that given the physician you go to, in this case, a cardiologist, each one of those specialists are looking for an answer to the question that sort of speaks to them directly.
Mhm.
And having these conversations is something that's so helpful, sort of overall, because it allows women to become armed with the information that can help sort of help them have a more successful appointment. You know, a cardiologist who might say it's time for MHT is a broad thinking cardiologist who understands the role of estrogen in particular. So thank you.
Right.
You're educating us and you're educating other physicians.